Hey everybody, I'm Dr. John Willardson, trustimplants.com. Let's take a look at another one of our patients here that we've had the pleasure of working on. This is a wonderful guy who, he had gone to the dentist over the years. They pulled a tooth here, pulled a tooth there, ultimately lost the majority of his molars. And what happened is you'll notice on his front teeth, now when you lose the molars, now our mouth, and I've said this 1,000 times, so if you've heard this already, I apologize, but our mouth is a biomechanical system. It has to be in balance. So you lose one tooth, all of a sudden the force is now changed. You lose another tooth, those forces are changed even more. You lose all of your molars, and now all of the force is in the front. And this is precisely what happened here in this case. Because the bone structure, and actually the tooth itself, was very solid and strong. It was sound, but he had worn it down almost to the gum line. And so you can see here how at one point his teeth were, kind of more in line like this, but after he lost his molars, everything collapsed. So his whole face collapses once he lost his molars. And so by utilizing, after we got the imaging, the CT scan, and all the information that I needed, we determined that it wasn't a viable option to try to restore these teeth because they were too far gone. And so we went ahead and we extracted all of the remaining teeth and had to rebuild the bite and the occlusion and the aesthetics. And so you'll see here how he's completely overclosed. So his bottom teeth are actually touching the roof of his mouth. And that's because he's lost his molars and he's lost what we call vertical dimension. And so by, taking this case and determining, all right, we've got to open back the vertical up so we can restore that nose to chin distance. And then also that restores the aesthetics. And it gives your face a relaxed look. You've seen probably the pictures of the little old ladies with the dentures out and how their jaws are, their chin is almost touching their nose. In reality, that's what's happening here. His chin is approximating his nose, and over time it makes you just look older. And so we went ahead and we extracted all of his remaining teeth, and we placed 12 implants, 6 on the upper, 6 on the lower, and here we have the case restored with a fixed zirconia upper and lower prosthesis. And so you can just see how it's changing the entire, it changes his persona, it changes the way he looks. His confidence is restored, not to mention the fact that we eliminated any infection, broken teeth, the situation that he had was dire. There was no other option. We had to pull the teeth out, and once the teeth are out, your options are either dentures or implants. There's really no other alternative besides those. And so he opted to go ahead and have the implants done and the reconstruction done. And you can see in the end the wonderful outcome that we were able to help this young man out with. So, and he'll tell you, his ability to chew and speak has completely changed. And so if your teeth are breaking down, if you are losing teeth, or if you've lost teeth, even if you've only lost one tooth, replace that tooth with a dental implant. And I would say that even obviously over a bridge, because a bridge you have to shave down the adjacent teeth. But more importantly, the bridge does not help maintain and preserve the bone. Around here, bone is important. We want that bone. We want to maintain that bone. We want to maintain your facial structure. We want to minimize the aging process as much as we possibly can. And so again, if you're losing teeth, missing teeth, or in the process of having to have your teeth removed, definitely bone graft. Get those extraction sites grafted and then replace the missing teeth with dental implants. I'm Dr. Willardson, trustimplants.com.